All Health with Mariposa.
Good afternoon to our viewers on Facebook Live. The session is in We Love Nogales. The Mariposa Community Health Center hosts a session regarding healthcare and topics of general interest that affect our community. We are privileged to host a session today on a topic that is in our minds, and not just in Nogales, Santa Cruz County, but across the country. We wanted to explore some of the facts that are known and share with our viewers the kinds of protocols that we have in place to keep our community safe. My name is Eladio Pereira. I'm the Chief Medical Officer at the Mariposa Community Health Center. I'm an internal medicine doctor in Nogales. Mariposa is a federally qualified health center with clinics in Nogales, Rico, Tubac, and Patagonia. We're very fortunate to have a group of experts that work locally. They do their daily duties in this area, and I invited them to share the important duty of educating our community on what we know. And as we explore the topic, we're going to learn that a lot of things are not known. We are learning daily through various sites and various federal agencies. And we'd like to share that with you. We'd like to tell you what we know, and we'll probably tell you what we don't know. We're going to explore ways to identify the illness, and more importantly, how to manage it and how to prevent it. So we have a good program today. Hope you enjoy it. Before I go further, I'm going to allow my guests to introduce themselves, their names, and what they do. Ray?
Thank you. Good afternoon. My name is Ray Sayer. I'm the Director of Emergency Management for Santa Cruz County.
Good evening. I'm Shelley Jacobs. I'm the Preparedness Coordinator with Santa Cruz County Health Services.
Good afternoon. I'm Dina Sanchez, Director of Support Services for Carondelet Holy Cross Hospital.
Fire Captain with Nogales Fire Department.
I'm Gary Karchner. I'm a nurse and the Emergency Department Manager at Carondelet Holy Cross Hospital.
And I'm Richard Johnson, Deputy Chief with Rio Rico Fire District.
Okay. Thank you to all of you. What I'd like to do, I'd like to talk about the illness for some time, and then I'll ask our guests to touch on certain areas of importance regarding community spread and things of that nature. This illness is caused by a virus. Viruses contain either DNA or RNA. This is a single-stranded RNA virus. So in terms of nomenclature, it's really important to do this. The illness is called COVID-19, right? Coronavirus disease 2019. The virus is called SARS-CoV-2, and that's important. I think when we talk about COVID-19, we're talking about the illness. We're not talking about the virus. This is an interesting virus because it's kind of related to other viruses that we have been exposed to in the past. Some of you may remember SARS years ago, and others may remember MERS. And those viruses were also respiratory viruses. They were coronaviruses. Most of them don't cause serious illness, but some do. Most patients get well on their own, but a percentage get really sick. They, at least early on, we think came from animals. At least the first exposures came from either a bat or a camel, and there may be other animals involved. The MERS came from camel. It appears that some of these coronavirus come from bats. But what happens is once we acquire the disease from an animal, there is human to human spread. And it appears to be pretty contagious. The illness at this moment is mostly spread person to person. And that's what we're here to talk about. Most people have to be in fairly close contact. And I think when we define that close contact, we're talking about 6 feet. This is what we call airborne transmission. And coronaviruses, by the way, are not the only ones who are transmitted this way. There are others involved. In fact, varicella, chickenpox, is airborne. TB is airborne. Measles is airborne. So it's not the only one, but it's about 6 feet. That's what when we talk about prevention, we're talking about the importance of staying away from sick people. Or staying home if we are sick, and we'll talk about that a little bit. So that person-to-person transmission is important. We call it respiratory droplets. That's what we refer to, and as such, we will inhale it from an infected individual. It goes through our mouth, our nose. It goes to the back of the throat, and goes through our lungs. That's how we get it. Most people do acquire the virus but don't get sick, or if they get sick, they can have mild illness. Unfortunately, some get really sick, and we're going to talk about that. Some of the writings include that it can be spread from infected surfaces or objects. That has been looked at. That has been researched. We don't have a lot of data on that. It's been shared by the experts caring for patients with coronavirus, that they're doing research on how to disinfect objects and surfaces. But that's not the main way of transmissibility. What we're talking about is person to person. And we think that most transmission occurs when someone is symptomatic. And that's really important because there are some diseases that are transmitted in the asymptomatic period. We know that. But at least with this virus, we think that the highest level of contagiousness occurs when someone is having symptoms. There may be some spread before symptoms, but that's why when we look at a person or investigation, we emphasize symptomatology. And we'll talk about that. The symptoms would be typically a high fever, and we frequently, when we talk about a high fever, we're talking about 103, 104, really high fever, and respiratory symptoms. This is a respiratory syndrome, cough and shortness of breath. Influenza tends to have more body aches, a lot of fatigue, and there could be some with this virus, but it's mostly fever. And if you look at the case definition, it involves mostly fever and respiratory symptoms. The incubation period is about 2 to 14 days. Thus, the criteria set by CDC to quarantine some patients. So it looks like after day 14, the chance of having the infection is pretty low. At the beginning, it was not clear. I read a report in which an incubation period has been shortened, maybe closer to 5 days. But at the moment, the cutoff date that we have in terms of incubation periods is 14 days, and people who have been exposed to an infected patient are quarantined for 14 days, and our public officials will verify that for us. I'm going to talk a little bit about prevention, and then I'm going to let others speak. I want to touch this really fast, but at the same time, it's really important. The main way to manage this illness is prevention at the moment. There's no known effective treatment to cure the virus. There's an antiviral being used in hospitals that are caring for these patients, but at the moment, there's no definite cure. So we want to prevent it. And when we talk about prevention, it's not just about coronavirus. It's about other respiratory viruses that include influenza. And in fact, if you look at the burden of disease, influenza infects 32 million people. So far, 18,000 people have died of influenza this year. Coronavirus is about 100 people, 108, and 9 have died. So in terms of burden of disease, influenza is a lot higher. So the specific recommendations set forth by CDC are easy to manage, easily understood, and I'd like to go through that before I let my colleagues speak. The first one is make sure you avoid contact with people who are sick. That includes staying home if you're sick, right? Number 3, avoid touching the eyes, the nose, and the mouth with your hands. Wash your hands often. The recommendation is soap and water for at least 20 seconds. That's the official recommendation by our public health officials. There are other ways of doing that. Alcohol-based, 60% alcohol will do. If you have dirty hands, though, you got to use soap and water, and for about 20. In fact, this is probably the most efficient way of preventing this virus. Yes, we want to talk about respiratory, but hand washing is clearly essential. Cover your cough with tissue and discard the tissue in the trash once used, and clean and disinfect touch surfaces and objects. And I'm going to come back to that because that's going to be the theme of this forum is prevention. Yes, we want to recognize the sick individual. You want to be reassured that we can manage this in this county, but prevention is key. And it's not just a responsibility of public health, the doctors and nurses, it's really us taking charge of this. And in the past, we've done it. When we had the H1N1, Santa Cruz County did really well because we did it ourselves. We cannot depend on others to do it. This is our community, this is our town, and it's a responsibility to do it. I'm going to stop right here. I have a lot of other comments to make, but I'm going to pass it around to Ray and Shirley, talk about public health issues, talk about community, contacts with emergency services, how you work with Maricopa County, how do you work with CDC, how do you work with other public health officials. I think the public want to know that we're in contact with those people, that we're getting daily briefings, and that we're implementing those recommendations right away. So, Shelley? Ray.
Hello. The Santa Cruz County Health Department preparedness program has been meeting weekly with the Arizona Department of Health Services in our group of other county that's what I am, a emergency preparedness coordinator, other coordinators across the state. And so we had our meeting today, and some of the guidelines as far as, disinfecting, we know that the state and the CDC is still looking at that. But I just want to get you an update also is, there's been one case in Maricopa County. There's been one presumptive positive case in Maricopa County. By presumptive positive, that means that the CDC needs to confirm that. The state can test, but the CDC still has to confirm that. We have not had any cases or patients that have presented with the virus here in Santa Cruz County. I also spoke today to the Office of Border Health, which is part of the Arizona Department of Health Services, and found out there are no current cases in Nogales, Sonora at this time. So that's very good news for all of us. And like Dr. Pereira says, hand washing. Wash your hands. After you blow your nose and throw your Kleenex in the trash, wash your hands, because that's going to be your most important preventative way to beat this virus and stay healthy.
I'm Ray from Emergency Manager for the county. Emergency management, we work with everyone every day, whether it be public health, law enforcement, emergency responders, hospitals, everyone. So it's very common for us to have these relationships. Our job in emergency management is to run the support role, find out what kind of needs are within the community, and do what we can to support public health by common messaging, or hospitals or emergency responders, whatever it might be. To that extent, we work extensively with everyone on their plans. Shelley didn't mention it, but we just did a tune-up on the pandemic influenza plan. I think she can talk about that more. But we have lots of plans, and we exercise those plans. Just 2 weeks ago, we did an exercise with public health in all the hospitals where we worked on a platform we call Web EOC, or Web Emergency Management, to where we practice doing messaging and ordering of resources and whatnot. We routinely practice and exercise doing that. I think from emergency management, from my standpoint, there's a couple things that you can do to help us here. One is don't speculate. There are trusted resources out there, and here's one of them here that can give you accurate information. Please don't go on social media and start making up stuff or following non-trusted resources, because it can take you down to the rabbit hole, and it's very difficult for us. How can you help us? If you're sick, stay home. Isolate. If you see someone sick, do that 6 foot, stay away, wash your hands, do the basic sanitation that we're going to need. Now, if you're running a business, think about your continuity plan. As we look forward and more cases are discovered, what could I do in my business, whether they be the county or any kind of business, to continue that? Do we step up sanitation? Can we work from home? Can we isolate? That sort of things, I think would be helpful to us. Doctor?
Thank you, Ray. Thank you, Shelley. A couple of things. As I think about the workflow and I think about the flow of patients, a couple of things come to mind. The first one is, if you're sick, stay home, right? If you come to a healthcare facility, call us first. I think that's important. We want to prevent the spread of the infection to others in the clinic or the hospital. And if you call us, we can manage that. We can do some screening questions. We can get some information ahead of time. And then we will make a decision about how to manage that. And typically, if the suspicion is high, we want to manage the patient outside the clinic, typically. We will put a surgical mask on. We will wear our personal protective equipment. We'll work with you to make sure you're stable. And then we call our colleagues to transport you to the hospital. And I'll move to that in just a moment. But one of the key ideas is what Ray says, is that we want to isolate the individual with a suspected infection. And that's key. And Holy Cross has 5 beds that are isolation beds, and we'll touch on that a moment ago. We don't want an infected patient around other people. This is spread very quickly. As far as I know, the virus is more contagious than influenza, probably less contagious than measles, essentially. But that's a lot. I mean, it's a significant problem for us as we try to contain the virus. So calls ahead. I think the same applies to the hospital. If you have a travel history, if you've been exposed to someone with a known illness, anything like that, call the hospital ahead. I'm having a fever, I'm having a cough. I just came from Spain, I just came from Italy, and that way the hospital can be ready. The same thing applies to Mariposa, and I'm sure applies to other clinics as well. Before I go to EMS in just a moment, real quick, make sure you get your vaccines done. Influenza vaccine is important. Sometimes the syndrome is not very distinguishable from influenza. We think we may sometimes, but the reality that the influenza also causes severe disease, and you want to get vaccinated against influenza. I also recommend that you become vaccinated against pertussis, which is whooping cough. The adult vaccine is called Tdap. We know that immunity sort of disappears over time in adults. Now we're recommending a booster as an adult, and then as of 2 weeks ago, the recommendations have changed. So the new TD every 10 should be Tdap. And Tdap is now also recommended for each pregnancy. So if someone is pregnant at around age 26, you should be vaccinated. It's not just one time for a woman is every pregnancy you need to be vaccinated. And of course, the pneumonia vaccine, either PCV13 or PPV323, either one, the doctor will tell you which one you need. Some of the recommendations just change. The pendulum is swinging back is to PPV323, then PCV13, now they're saying PPV323. But the doctor can help you figure that out. So these are respiratory syndromes, and we should be able to manage that. Remember, viral syndromes sometimes cause disease by lowering your immune system, and then you get a secondary bacterial infection. So the idea is about become vaccinated against pneumococcal pneumonia with either PPV3, which is Pneumovax, or PCV13, which is called the Prevnar. So as I'm thinking about the workflow, our EMS colleagues come in, and they're going to be transporting the patient from either Mariposa to Holy Cross, or from Holy Cross to a high level of care. And they need to know the syndrome. They need to know what to do. They have their base hospital collaborating as well, so they'll know too. They need to wear the PPE, or personal protective equipment. So there are a lot of things on EMS side. And so I have two great colleagues here that can tell us about the precautions you take, the awareness you need to have, and the importance you knowing ahead of time that there's a patient who may have coronavirus, because you have your own protocol. So I'm going to let our colleagues, Rich and Chris, talk about EMS, and then I'll move to the hospital side, then I'll finish some of the talks, and we'll put it all together. Chris?
Okay. So our involvement, the first one is receiving the 911 call. And what we've done is our administration has sent a series of questions to our dispatchers so they can ask the 911 caller and then be able to dispatch us accordingly. Some of those questions include what kind of symptoms they have. Are they running a fever? Do they have a cough? Are they short of breath? They want to know the duration of those symptoms. And they might even ask if there has been any travel. Once they receive all that information, they then dispatch us, relay that information. And our typical response is an engine and an ambulance, typically 5 to 6 people. So we get to the incident, and one of the first things we want to do if we know we have those kind of symptoms going on is limit the amount of personnel that we send into the residence or building. So where typically we would all 5 or 6 go in, we would just be a little more precautious and maybe send 2 people in and then get an update from them and then see if equipment is needed or if we can all just continue on and go inside the building. As far as what we wear, we want to have our gloves on, single pair gloves, some kind of respiratory protection. We in Nogales, we use the N95 masks, disposable full gowns, full face mask or shield, something that covers the entire face, especially any type of like mucous membranes or the eyes. And that's the initial part. Now we get into the treatment part, and some of the stuff that we want to be careful with, especially with these type of patients, is going to be anything that produces some type of aerosol. So if we're going to maybe use a BVM on a patient, maybe suction, intubate, give a nebulizer treatment, or give him CPAP, again, limit the amount of personnel that are in contact with that patient, because now that exposure went up a bit. And then after that, we want to make sure we document everything accordingly and report it accordingly. Transporting to the hospital, we want to make sure to let the receiving facility know, such as Holy Cross Hospital, or if they go to a Tucson-based hospital, we want to make sure and communicate with them too, and our base hospital, which is Banner UMC. So then what we do after the call, it's going to be basic decon, maybe with a little more emphasis into it and attention to it. Dispose of any PPE that was used, dispose of it accordingly. We want to clean and disinfect the ambulance. One of the other things I didn't mention, but when we transport, there is a door between the patient compartment and the driver compartment, and another precaution we would do is close that door to limit the exposure to the driver of the ambulance. Going back to the station, some of the practices there is going to be washing your hands for 20 seconds, like was mentioned. We recommend, if it's available, taking off your uniform, putting on a different one, washing that one, and possibly even showering, depending on, the circumstance of that call. Possibly document an exposure. And the last part is just kind of monitor personnel. One, watch out for the other and see if you see any symptoms start arising, and just be kind of aware of that. So that's basically our involvement and response to, not just what we're dealing with right now, but anytime we have anything that's a communicable disease.
Thank you, Chris. Rich, would you like to add other comments regarding transport and precautions for your staff, and what would you like to tell our patients given this opportunity? What should we be aware of as you help us in this setting?
I think Chris was pretty thorough with his
Okay.
go through there, but I guess the thing that I'm looking at is our personnel, protecting our personnel from something that's going on here. And while this is a very serious disease, there are a number of symptoms, as the doctor has said, that mimic other things. And being aware of the fact that because you're feeling bad, because you're coughing, because you have a fever that is a brief fever, it does not mean that you have this virus and that you are needing that. So being aware and being truthful with the questioning when our folks arrive. The doctors talked about a 6-foot barrier for space. If we are in the back of an ambulance, we don't have that ability to be 6 feet from you. So we are going to be there. We're going to probably be a little more aware for the next little while. Yeah. With our personnel, and paying attention to the fact that hoping that we can keep the providers safe from what's going on, and at the same time not take members of the public to a facility where they are more likely to be exposed to this than what they would be sitting in their living room at home. So if we come and we are questioning your need to go because of the symptoms that you're presenting to us, it's not because we don't care or that we want you to be sick. We just want you not to get sicker by being exposed to other folks that might have a more serious disease.
Yeah, well said. That's exactly right. And so a couple of things on that. Patients need to tell us the truth, right? If they travel, and that's so. We have learned about community spread. Those are individuals with no travel history. Washington State reported a few cases. Now there are other cases. But still, it's important to know where you have been. And even though the official case definition is 14 days, I like to tell our providers, ask, where have you been in the last 30 days? Because you never know. I think 14 days is what we work with on CDC. That's great. But I think expanding that to about 30 days is a good practice. Not just to diagnose coronavirus, but to diagnose other diseases that are certainly pertinent to other countries. So well said. Thank you to our colleagues on EMS. So once we transport the patient, they'll go to the hospital, right? And that's where our Holy Cross colleagues come in. They'll have the opportunity to assess the patient, maybe intervene early. They're going to have to take some precautions as well. They'll be working with other hospitals, but the idea about Holy Cross is that they're there to help us. They have some isolation rooms, but I'm going to let Gary and Dina speak briefly about what you have to keep us safe and so on. So I'll let Dina and Gary speak on that aspect.
Thank you, Dr. Pereira. I think it's important from a hospital standpoint for the community to know that we've taken the appropriate steps to not only have the trained professionals in-house, but definitely the necessary equipment that we need in order to address the need. It's as with any communicable disease, as our patients enter our facility, the hospital staff have their process and protocol that they do, as the staff is well aware in the emergency department. The questioning that goes along with all of my counterparts, it's the same questioning, your recent travel, and the detailed symptoms. So from a hospital standpoint, I can tell you that we are ready to respond to the need.
Gary, you have anything else to add from the emergency room's point of view? You're there in the midst of the action, so you're
Sure.
ready.
Sure, yeah, I think that it's, first of all, I'd like to thank our partners here that have been just excellent. From the clinical side, I'd just like to emphasize that our teams are in constant review of the infection prevention process, updating our patient screenings as they change, following the recommendations of the CDC, which has been ongoing and changing, and making sure that we get those out to the community members.
Great, thank you, Gary. Shelley?
I just wanted to follow up that after the patient's at the hospital, then public health gets to really go to work. And so that's where we're going to be calling all of those contacts of whoever lives or who's ever been in that area where that patient that's sick has been. And so, I don't know, there's other diseases that we have to do investigative work on, and that's why it's so very important to be sure and tell the truth about what your travels are, who you've been with, and where you've been, so we can get that follow-up.
And that's important to prevent spread. I mean, this is a public health issue. It's not about me or anyone else. It's about spread. I have a few other comments to make, and then I'll open it for question. We probably have about 500,000 questions, right? So it will take a few, but just a couple of things. So we follow CDC guidelines closely, and I think our communities should know that this is what we pay attention to. My computer is on CDC website all day long. I look at it every hour or so to see if there's anything new. For those of you with computers, in terms of travel, you should log on to .gov and look at the travel map, and it tells you which countries have travel restrictions and which ones do not. Given our proximity, Mexico has no travel restrictions at this moment. The other ones have. Italy does, of course, China, Iran, and a few others. So log on to the cdc.gov, and it gives you a real-time access to that information. Number two is we also pay attention to Arizona Department of Health Services along with the county to follow specific recommendations, and that's really important. A couple of things. One is, so I think at this point it's generally accepted that if you traveled to China a month ago and you don't have symptoms, you don't have coronavirus. That's important. So if it's been over 14 days, chances are you don't have it. That doesn't mean you don't want access to healthcare. We're happy to see you. But in terms of probability, the thought process by CDC is that over 2 weeks is unlikely to have coronavirus. So something to keep in mind. We always want that travel history, though. We want to know. And if we're not sure, we'll contact our county colleagues, we'll contact Maricopa County, and we'll call CDC and see what we should do. And there are criteria now to collect samples. The testing can be done in Phoenix at the moment, but Shelley tells us they must be confirmed by CDC. They can do over 400 specimens a day. They're doing nasopharyngeal samples. They're doing oropharyngeal samples, and if possible, the sputum. But that's not the scope of this discussion. There are samples that must be taken to make a diagnosis. And finally, I want to emphasize the prevention again one more time. This is what public health is all about. So avoid close contact with people who are sick. Avoid touching the eyes and the nose and the mouth. Stay home when you're sick. Cover your mouth when you cough with tissue. Throw the tissue in the trash. Wash your hands for 20 seconds. And there will be an exam asking you for how many seconds you have to wash your hands. And the answer is 20. And clean and disinfect objects. Oh, by the way, CDC does not recommend, if you're not sick, they don't recommend you wear a mask. It's only for the people who are sick. Let me repeat that. CDC at the moment does not recommend that individual wear a mask if you're well, only if you're sick. And that's really important. I forgot to say that early on. So, any other things from our distinguished guest? Yes, Shelley.
The Arizona Department of Health Services this week are having some webinars. And there was one for businesses, one for healthcare facilities, one for healthcare providers, and one for the schools. And you can go to their website, it's www.azdhs.gov, and go to the coronavirus page, and those webinars will be listed on there with the dates and times.
So we have a few questions. They all are difficult questions, so we're not going to be able to answer them. So the first question, we're going to do a tag team here with our public health colleagues. Is it safe to use utensils in restaurants? So, so my answers are going to be maybe. So this is changing. Remember, there's research going on in terms of disinfectant and cleaning and all of that. That's all new. So my answer is, so first of all, Arizona is a low-risk state. So generally speaking, everywhere we go is low risk, right? We're not high risk. That's really important to say. So the idea is that we should go about our lives the way we do, take basic precautions, and so on. So my answer is, it is as safe as any restaurant wants to make it, essentially. So, I mean, you do restaurant inspections. Your department does. So my answer is, they have to follow guidelines created by our public health colleagues, and in terms of cleaning and all these things, and that should be enough. And I think that would be the answer that the experts would give in this case. I am not. So remember, the main way of getting the disease is respiratory. It's not by objects, and utensils are objects. So you agree with that, Shelley? I agree with that. Okay, so we got 1 out of 3 done. All right. What to do if you become infected? How can you recover quickly? Home care remedies. Wow, that's a tough question. Only a few doctors in this country have had the experience of treating patients with coronavirus, right? So there are about 108 cases as of 3 hours ago. 27 in Washington, 20 in California, and then they're spread over a few other states. So only if a few doctors have that experience. So treatment is supportive care at the moment, meaning IV fluids for dehydration, correcting electrolyte abnormalities. If potassium is low, magnesium is low, they have diarrhea, they have vomiting. So you treat conservatively with medications. There's a drug that's being used in Nebraska. It's an antiviral that they're testing. That's a research project. We don't know. And I think we'll know whether that drug is effective or not. I am not aware of anything else that can make patients recover quicker. So typically, the disease runs its course. In most cases, it is mild, and people do well. A small group will get really sick, and those are the ones that become hospitalized for several days. So the recovery goes with decreased cough, better breathing, and low fevers. That's essentially how we know. The chest X-ray gets better. So there are some parameters that doctors follow, just like pneumonia. So the tests are done on 3 days after you recover to document that the virus is no longer present. And so they do daily tests for 3 days. And if they're negative, they'll let you go, essentially. It used to be 2, and I think now it's 3. But that's not my area. I have not cared for anyone with coronavirus. But generally speaking, it runs its course. It's conservative treatment. Medications are being used and tested. But there are no home remedies that I know of that will accelerate recovery. I think that's fair. Would you, Shelley, have you heard otherwise?
I have not.
Okay.
I'm thinking, excuse me. I was just thinking maybe, we have over-the-counter, vitamin C for your immune system. We have over-the-counter zinc for your immune system. I'm not saying to go use that, but that's just stuff that I'm aware of that's out there that I personally use sometimes if I start getting sick.
So, I think in terms of treatments, good nutrition, we want to prevent illnesses in primary care, and the same thing applies. Good nutrition, exercise daily, 150 minutes a week, no smoking, walk every day. I mean, there are some things that we do that's not going to help you in this illness, but so general recommendations from a primary care doctor to the patients. I mean, I think we can help, but the patient needs to help himself or herself to do all that. Nutrition, maintaining good weight, exercising, no smoking, all of these things. No smoking and no vaping. I always forget to say that. Now I have to add smoking and vaping, both, because you never know. The final question, what happens if a patient becomes infected and doesn't have health insurance? Who pays for the medical costs? That's outside my area of expertise. If patients access a medical facility, including Mariposa and Holy Cross, there are people that will help patients apply for benefits for their eligibility specialists, and they go through the process. I am not an expert on that, but there are programs that can be accessed through various state programs. I don't have in my mind the qualification criteria, but those are what we call eligibility specialists, and we would refer to eligibility, and they're treated like any other illness. So I'm going to ask my colleagues in the background to see if there are any other questions or not. Other questions, Marco, Tia? I answer all 3. Oh, there are 4? No, 3. Anything else? You want me to look at the phone? There are a lot of questions. Oh, so we'll talk about vaccines? Yeah, of course. So the vaccines are a lot of vaccines, but let me talk generally in general terms. So vaccines are considered, by the way, one of the greatest advances in medicine in mankind. Sometimes we forget that. In the old days, people die of polio, smallpox. When I was in training, people still die of Haemophilus influenza meningitis. When influenza meningitis vaccine came out, I've never seen a case of meningitis. Our pediatricians don't see a case of meningitis anymore because of the vaccines. I mean, it's remarkable. That's the editorial comment. So in terms of vaccine, as we get older, we need vaccines. So let's go over that. So our adult vaccines include, and I'm going to talk about coronavirus, talk about general. So, shingles vaccine is important. There are 2 kinds of vaccines. You can ask your provider which one you need. Typically, there are 50 or 60 depending on the vaccine. So we can prevent herpes zoster reactivation disease with vaccine. So that's a good vaccine to get. If you get shingles, your immune system goes down and you get sick. There's a relationship between herpes zoster and infections and stroke within a month. So we want to prevent shingles. Hepatitis A and B, good vaccines against that. So you want to make sure you're vaccinated against Hep A and Hep B. Hep B are typically 3 shots, 0, 1, and 6 months. It's a good vaccine, very effective. And then the ones that we spoke about earlier, influenza or the flu shot is really important. 45% effective now, but we should get it. That's what CDC says, and that's what we should do. And then pertussis, whooping cough, Tdap is recommended. And then pneumonia, typically over 65, either Pneumovax or PCV13. Younger if you have other comorbidities, such as asthma and the other criteria. So those are the main vaccines to give. I could speak a lot about vaccines, but those are the main ones that I want to emphasize. Okay, so there are only cases reported in Maricopa County. Yes, sir. Nowhere else. They wanted us to restate that. So let's restate it. Maricopa County.
In Arizona, there has been one confirmed case in Maricopa County that has since recovered. There is one case that is presumptive positive, which means it tested positive at the state lab in Arizona, but has been sent to the CDC to confirm. So we cannot say it's confirmed yet until CDC says so.
And that's as of now.
That's right now.
Tomorrow morning, when we wake up, look at the ADHS website, they may be different. And this is fluid. This is very dynamic, so it may change tomorrow. So, in terms of if someone suspects they have coronavirus, they should call ahead. That's the bottom line. They should call ahead wherever you're going. Typically, they should, if you're sick, if you're quite sick, you need to go to the hospital, right? So call ahead. Call the hospital. Say, hey, I traveled to Italy 10 days ago. I'm back. I have fever and coughing. I'm a little worried about this. Call the hospital so the hospital can be ready. That's the workflow, is to call ahead. The idea is that if you're potentially infectious, you don't want to transmit the disease to others. So going to a clinic is not a good idea. You need to be in isolation. That's essential. And there's something called self-isolation, which you can do at home. If you're not very sick and you want to stay there, I think that's perfectly okay. Now, you need to use your judgment of that. Obviously, you want to seek health care. That's what we want. But there's also something called self-isolation. When you say, I'm sick, I think I could do this another day. If I get sick, or go to the hospital. So that's perfectly okay. And self-isolation is a term that's used by the Yale School of Public Health a lot. And I heard a podcast on that recently. And the other question, is it true that the virus does not survive in hot weather? I don't know. That's a good question. We'll have to. I'm going to assign our colleagues in the back to look that up for us. And before the broadcast ends, maybe we can send that out. If not, we'll send an email or we put it on our website. So the question is it true the virus does not survive in hot weather? you have a respiratory syndrome, it's more likely to be influenza than corona. So I think we
Health with Mariposa.